Hi and welcome back. The ORM module will be used for documentation for continued recovery patients or surgical outpatients. To access the ORM, or the Operating Room Management module, you select Ancillary, Operating Room Management, and Nurse Desktop. This will bring you to the patient's work list. This work list will allow you to customize the work list to display only your assigned patients. The Compile Work List button will allow you to enter selection criteria to determine which cases appear on your work list. You can select by specific operating rooms, a room group, a specific date, a surgeon, an anesthesiologist, a specific case. The Add Case button will allow you to add a case to your work list by searching by a patient name to find. The Go To Case button will allow you to find and highlight a patient that has already been added to your work list. The Clear Work List button will allow you to remove all of your patients from your work list. The Remove Case will remove only a selected case from your work list. The Case Review tab will allow you to view information that has been documented throughout the operative phase. The Medications tab will allow you to view medications that have been administered interoperatively. The Intake and Output will allow you to review I's and O's documented within the OR phase. The Times will allow you to view the patient's times associated to their surgery. Vital Signs will allow you to view vital signs through the various stages within the patient's surgery. The Notes tab will allow you to view any patient notes. Procedures will allow you to view the procedure, and Items and Implants will allow you to view those here. On the right side of the screen, the Big Board button will return you to the main menu. The Phase 2 opens the documentation for Phase 2 or continued recovery charting. The Open Chart button will open the chart to the EMR or OM. The PCS button will open the chart to the PCS menu and will allow for documentation of medications, blood transfusion, and discharge information. The Allergies tab will allow you to update and enter allergy information. And the Reports would allow you to print out a list of printable reports. From within the Phase 2 tab, this is where the majority of your documentation will be taking place. The Assessment tab will include all of the Phase 2 assessments. The list will have the most of the assessments you will need to document. You do have the ability to add additional assessments as needed. If you note a blue circle anywhere and you click directly on that, it will display past documentation that has been completed by another user. To document an assessment or multiple assessments, place a check mark next to the assessment you're documenting, and then select Document from the footer button. You have the ability to view the documentation in a flow sheet or a spreadsheet mode. If you choose to use the flow sheet, merely select OK, and you're brought to a list of associated assessments to the particular main assessment from the front page. You would have the ability to select the one you're completing and complete the documentation as you need. And then by choosing the Go To button at the bottom, you would have the ability to go to the next assessment in the series. It's important to note that the PARSAP score from within the ORM module does not total itself. That's why the number is attached to each selection so that you're able to total and calculate the total score yourself. By continuing to select the go-to, you would be able to choose the assessments you want to complete. If you have completed all of your documentation at that point in time, you would merely select the Save button, and that information would be saved. The Phase 2 record contains important information about the Phase 2. By selecting the plus sign at the top, all of your below sections will expand. The time section will allow you to display the enter and start time of Phase 2. The notes will allow you to document patient notes. If there is a patient-specific condition that has not been covered within the assessment, a note can be added from this section. The transfer data information does need to be completed upon completion of Phase 2, in addition to PCS discharge documentation. From within the Phase 2, the footer buttons include the Print button or the Case Review button. Again, just as seen before, the Case Review button will allow you to access the documentation that was completed interoperatively so that you can review. It's important to note that any documentation that needs to be completed in regards to medication, blood transfusion, or discharge needs to be completed by accessing the patient's PCS chart by clicking on the PCS button, and then accessing the buttons we've already discussed, the MAR, the TAR, or the discharge button. Thank you for your time, and we'll see